That's a great question. Neuron is actually a very commonly known term. Neuron essentially means brain cell, but we didn't exactly choose this name in reference to that. We use it as an abbreviated form of neuro repair. Because we are a clinic aimed at repairing brain tissue, we are a neuro repair center. The Neur-On Clinic is a fascinating place since it operates as a hybrid stroke center aiming to revascularize but also to repair the brain. We are a center that focuses on aiming to protect every single brain cell and making efforts to do so as soon as the patient steps through the emergency service door. We are a center because when we talk about rehabilitation, it is essential to do this on a solid background, which is a repaired tissue. The brain's blood vessels need to be opened and blood must flow back to that tissue in the brain for the entire repair process to take place. This is our main objective. We have a specific goal and a message to convey to the community. Following a stroke, the first month is an extremely important period for the brain to regain its function and repair itself. During this period, there should be no interruptions in services or treatments received. There should be no indecision whatsoever. Therefore, we are New Generation Stroke Center, which prioritizes the first month after stroke onset in order to seamlessly integrate services. It's not just about treating patients or opening arteries. We want to trigger and initiate the repair processes and rehabilitate the patients during this process. As can be inferred from our objectives, we exclusively deal with the treatment of stroke patients. We refer to hemiparetic or hemiplegic patients when we talk about strokes, meaning those with one side affected. Unfortunately, rehabilitation treatments given to these patients today are begun to be applied after this critical period has passed and administered in very short treatment sessions. Neur-On Clinic's primary goal is to start rehabilitation early, but also to make it task-oriented in a repetitive, intense, and long format in treatment sessions lasting 2.5 to 3 hours for our patients. It indeed is a very challenging process to provide this, but we have embarked on this journey. Of course, it is not enough. Exercise programs alone are not enough for stroke rehabilitation or brain repair. Therefore, we actually call ourselves a neuro repair center. Besides the early starting exercise program, which have the characteristics I mentioned earlier, intensive, repetitive, and task-oriented, we offer numerous other treatments which overall aid the recovery process. So the answer to your question is not enough. The patient should also benefit from other treatments. There are a couple innovative methods, like what? You know that while patients are treated in a physical therapy center, the main purpose is to make them exercise. But our recommendation, and of course not just ours, I am referring to international guidelines. In fact, the more a movement is contemplated and attempted, even if you can't perform it, the more you strive to do it and try to inhibit the movement. If you are watching how much someone else executes the movement you wish to perform, these are very important principles behind many evidence-based therapies for the recovery of the voluntary movements. The techniques I mentioned are established treatments that have demonstrated effectiveness individually, yet unfortunately they lack sufficient application in practice. we provide a new method of treatment known as RecoverX at our center, RecoverX groups. All these therapy principles I mentioned before under one treatment approach. We start the therapy sessions with RecoverX with the main aim to prime the motor program. For a movement to be relearned, all the connections in the brain that enable that movement must be activated. Damaged connections must be retriggered. They need to be restored. Other existing connections must also be activated alongside them. In other words, we need to facilitate motor learning and the relearning of movements. We prime the brain not only with RecoverX, but also by applying central stimulation therapies. Among these, the most important is transcranial magnetic stimulation. Another method is known as TDCS, which deliver direct electrical currents. These methods are scientifically proven but are not routinely implemented in daily practice. Here, we incorporate these methods with RecoverX as fundamental practices in our daily routine. I knew this question would come, of course, because it's a very crucial question. The brain's ability to recover and start the repair process. And sadly, there are numerous medications today that enable exercises to be conducted with enhanced brain support. None exist. Not every drug studied has demonstrated adequate efficacy, but we have one medication, we have great faith in it, and we use it. We utilize the essence of 9 different plants. Our key observation in treated patients is treatment moves faster than in untreated patients, allowing levels achievable in 1 or 6 years to be reached in just a few months. In reality, it becomes possible to attain that level within the initial months. Our outcomes are slightly improved compared to when no medication was administered. Naturally, these results are not ours. They come from high evidence studies done internationally. What do? We have incorporated these medications into daily practice. Thus, we have a supportive medication. However, that's not the only thing. Science is progressing, especially neuroscience is advancing. Right now, the subject of stem cells for aiding brain repair is becoming quite popular. In fact, if given in such a way, its usefulness has almost been demonstrated. In the initial phase, known as hyperacute, we clear the blocked brain vessel. When we clear it, blood returns to the harmed brain tissue. Cells and tissues revive. At that moment, within a few days, a young group extracted from the patient's bone marrow, when you give anti-inflammatory drugs there, results are much better. There is evidence that the tissue, which would have healed in 6 months to a year, can actually recover much earlier within the first 3 months. At this time, besides exercises and brain stimulation, the 2 main treatments we recommend are the medication and the stem cell or cellular therapy I referred to. This is a crucial question. We have a limitation. It aligns well with what we've talked about from the start. We embarked on a mission to do everything possible to aid brain repair during the early phase. The brain repairs itself most vigorously in the first month, right after the stroke. Therefore, naturally, our main aim is to treat patients admitted to our unit right after the onset of stroke. Patients admitted in other hospitals, but looking for a place of early rehabilitation after the 3rd, the 5th day, or a week after their stroke onset, with the aim to benefit from these treatment methods are accepted. Certainly, rehabilitation therapy is effective for up to 6 months, and its effectiveness persists beyond that. But a treatment method that starts to plateau. We accept all patients, but if you want a message, we are here for the first month. Foreign patients, of course. A community of patients we wish to treat. We believe this patient group won't contact us too soon, but as I said before, stroke rehab, the brain's recovery process takes up to 6 months. Therefore, even after the first month, we are already adapted to provide all these services to patients who apply to us within 3 to 6 months. We are a new type of center. Our goals are actually very diverse, very different, and quite intense. We are here. A single step is all it takes to reach us.